Good morning to everyone. On behalf of Professor Mutwa, the Vice Chancellor of Nelson Mandela University, I'm privileged to say a few words this morning of welcome. Welcome to the President and members of the International Narcotics Control Board and other guests who have joined us, both online and in this venue today. Where we're situated in person today is in Koberga, which is at the southern tip of Africa, and it is known as the Friendly City. So I hope that across the physical and virtual spaces, you can sense this heartfelt welcome. The main role of the International Narcotics Control Board is to monitor and support government's implementation of the United Nations International Drug Control Conventions. We are here today to celebrate the launch of the INCB's 2021 annual report. The reason the board releases annual reports is to inform member states, departments of health, competent authorities, and so on, NGOs, the general public, about the board's activities in the past year. This year, Professor I always call her Zuki, so let me do that. Professor Zukiswa Zingela, as a board member of the INCB and the Executive Dean of Health Sciences at Nelson Mandela University, will present the report, which is a comprehensive survey of the drug control situation in various parts of the world. Professor Zingela holds a Master of Medicine in Psychiatry from the University of Pretoria, a FCPsych from the Colleges of Medicine of South Africa, is a qualified psychiatrist, and sits on the Medical and Dental Board of the Health Professions Council of South Africa. So it gives me great pleasure to call on you, Zuki, to the podium to present the 2021 annual report of the International Narcotics Control Board.
Thank you very much to our DVC of Learning and Teaching, Professor Cheryl Foxcroft. And, just to kick off, I would like to first give us an overview of the annual report for 2021, specifically what we're going to be covering. First of all, we're going to go through the highlights of the chapter 1 of our annual report. And the chapter 1 for 2021 is specifically focusing on illicit financial flows related to drug trafficking and their impact on development and security. We're then also going to touch on functioning of the internal drug or international drug control system, global issues and regional analysis, and we're also going to then look at recommendations. Lastly, we have one or two highlights that we want to share with regards to the precursor report. So if we then look at chapter 1, which deals with the illicit financial flows related to drug trafficking, which threaten development and security globally, there are a few factors that we'd like to highlight. First of all, the illicit financial flows are used by organized criminal groups who seek to maximize their profits and serve as the lifeblood of all aspects of trafficking. And this is the reason that as the board, we thought it important to make that our chapter 1 this year. Curbing illicit financial flows, therefore, is essential to addressing drug trafficking around the world. Illicit financial flows will refer to money which is illegally earned, transferred, or used, which crosses international borders. The acts themselves are illegal. The funds result from illegal acts, and or the funds are used for illegal purposes. So that is what we're referring to when we're talking about illicit financial flows. Money laundering mechanisms which have been used to achieve these ends include banking, which we see as relatively normal, but actually hides these illicit flows, cash smuggling, using money service providers to shift money around, alternative remittance systems, for example, Hawala, stores of value, trade-based, mobile or internet payments, cryptocurrencies, real estate, and front companies. So we can see that this involves a wide range of activities that we need to be vigilant to. In addition, what is also important is that having been given this kind of information or having this information available requires that member states be vigilant and focus on supply and demand reduction strategies that also address illicit financial flows and engage the public and private sector as well as civil society. It is important, therefore, for member states to adhere to and implement relevant regulations and instruments to combat illicit financial flows. Equally, it is important to strengthen anti-money laundering measures while adopting transparency laws to combat impunity. We also advise that countries should have specialized units or task forces. If none exist, they should actually be established. Raise awareness to explore the potential for utilizing proceeds of asset recovery and forfeiture of property related specifically to drug trafficking to expand the availability of drug prevention, treatment, and rehabilitation services. Prevent exploitation of newly emerging financial services, for example, the e-wallet, and promote a culture of accountability and transparency. This can be done, for example, by including civic and moral values as well as ethical behaviors in educational curricula from an early stage. Then we move on to Chapter 2, which looks at the functioning of the international drug control systems. What we have done in the annual report is to focus on promoting the consistent application of the international drug control treaties, ensuring the availability of internationally controlled substances for medical and scientific purposes. This is especially important when it comes to emergency situations where there is conflict across the world, to make sure that in such instances, communities affected by such conflict also have equal access to internationally controlled substances for medical use. Actions taken to ensure the implementation of the international drug control treaties are also covered in Chapter 2. Just to give us the background, if we look at the conventions that we are referring to, that we work with in order to support member states, we are dealing with the Single Convention on Narcotics Drug of 1961, the Convention on Psychotropic Substances of 1971, as well as the Convention Against Illicit Trafficking in Narcotics, Drugs, and Psychotropic Substances of 1988. If you look at all three conventions, we have got a number of states which have ratified or acceded to these conventions. So the 1961 convention, 186 states have ratified or acceded to it. The 1971 convention, we have 184 states which have acceded or ratified. And then for the third convention, which is the 1988 convention, we have 191 states that have ratified or acceded to it. So just to touch on scheduling, which is also part of the activities that we are involved in terms of the controlled substances, we have different groups of drugs that have been scheduled. Narcotics drugs, for example, in Schedule 1, we've got isotoniazine under psychotropic substances. We've got a number of them which have been scheduled in Schedule 2, and precursor chemicals similarly. In October 2021, for example, the United States proposed to schedule 3 precursors of fentanyls, and the governments were invited to submit comments and information, and the board to make scheduling recommendations to the CND of which was held as the 65th session. So if we then look at the issue of scheduling, what does it have to do with the work that we're doing? If you remember, the board is dealing and focusing on controlled substances, and what we're finding is that in some instances, drug traffickers will target certain substances as well as certain precursor chemicals to try and use them to produce illicit substances. So scheduling becomes one very important way in which we then try and bring better control into that kind of activity. So materials and equipments used in illicit drug manufacture. We see a rapid evolution of illicit drug manufacture, which requires a speedier response to better implement Article 13 of the 1988 Convention on matters relating to materials and equipment used in illicit drug manufacture. The INCB expert group meeting on enhancing operational use of Article 13 also produced successful multilateral cooperation to prevent and investigate diversion of specialized equipment, as well as awareness raising and guidance, producing a document from that. INCB guidelines to prevent and investigate the diversion of materials and equipment essential for illicit drug manufacture has also been produced in all United Nations official languages. What is really important, which I touched on earlier, is making sure that there is availability of internationally controlled substances, which are then used for medical and scientific purposes. If we look at the COVID-19 pandemic, there was a huge and significant impact on global supply of these substances. There was also increased consumption for reasons related to COVID-19 and the symptoms. There was increased manufacture and also increased stock of some narcotic drugs as a result. Treatment of severe cases, for example, required the easy and accessible means to drugs like midazolam under Schedule 4, the 1971 Convention. And we also had persistent consumption gaps between the regions of the world. Consumption, for example, concentrated in Europe and North America, while other regions often showed insufficient consumption for drugs which were required for medical needs. And opioid raw materials sufficient for reported global needs was also an issue that we focused on. If one, for example, looks at morphine, and one takes the statistics of the 2020 consumption in relation to population, we see that combined, Europe and the United States use more than 70%, while the rest is used by the rest of the world. So this then highlights the inequity in terms of consumption of these scheduled substances. We also have partners as well as internal processes within the board which assist us in rapid detection of dangerous substances. So for example, the INCB Global Rapid Interdiction of Dangerous Substances Program, which we refer to as GRIDS, has managed to do quite substantive work. For example, we had 4 confidential global alerts and special notices, which we dealt with. We had 10 training sessions, which focused on 750 officers, covering 84 member states and international organizations. We also held or hold public-private partnerships to assist us in this process. INCB lists of fentanyl-related substances, non-medical opioids, and other new precursor drugs with no known legitimate use share these very relevant information with member states and organizations. In addition, we also have the Ionics and Operation New Horizon projects, which also assist in this rapid detection of dangerous substances. In the third chapter, we look at global issues. This means that we'll also touch on different issues related to different areas And I think that will be important in terms of recognizing where each area fits into the global picture. So I think the first thing to highlight is that we do have terminologies that require a common understanding, which include the term legalization, what does it mean, decriminalization, what that means, and also depenalization. Use of social media in promoting non-medical use of drugs is a growing challenge that we also need to deal with. And then timely supply of controlled substances in humanitarian settings. You will also remember that I mentioned it in the beginning as well. So I'm talking about settings where we are dealing with humanitarian crisis. Manufacture and proliferation of fentanyl analogs, because unfortunately that then gets diverted into the illicit drug trafficking trade, and then coping with the challenging evolution of chemical precursors. So first of all, if we look at the terminology, when we talk about legalization, we are talking about the regulation and commercialization of internationally controlled substances for non-medical and non-scientific purposes. And we should be aware that when this happens, it can contravene the conventions as we laid them out earlier. Decriminalization, on the other hand, refers to policies that remove criminal sanctions for personal drug use and minor drug offenses, while depenalization describes a situation where the behavior remains a criminal offense, but there is a reduction in the use of existing criminal sanctions, which does not require changes to the law. So in putting these understanding of this terminology out there, we are driving the focus to be on making sure that when we talk about legalization, decriminalization, and depenalization, we are all on the same page. Use of social media in prompting non-medical use of drugs. This is a growing challenge, as I mentioned before, and we're finding social media posts which promote negative behaviors by glamorizing non-medical drug use without focusing on the negative effects. Young people are then the main users of the social media sites, and we see a link between social media exposure and drug use. Non-medical use of prescription medication, especially amongst the young, is linked to social media use. So social media companies have global reach, which we all know, making it very difficult to bring cases against users who promote illicit activities related to drug use. And then to touch on the specifics of what the board has done in regard to timely supply of controlled substances during emergency situations. I'd like to touch a bit on the Ukraine situation and the developing humanitarian crisis there. The board is deeply concerned about the situation in Ukraine, with more than almost 2 million refugees having fled from Ukraine since the beginning of the war. The acute and growing humanitarian needs resulting from this emergency situation require urgent action to ensure unimpeded access to medications, including medicines containing internationally controlled narcotic drugs and psychotropic substances. Just last night, I saw an interview where somebody who works for the Red Cross indicated that they were busy running out of essential medications. So the question is, what is the board's role in this kind of situation? So what we've done is, on the 28th of February, we already called for urgent action to ensure the availability of controlled substances in Ukraine and neighboring countries. This includes opioids, analgesics for the treatment of pain, substances for sedation for medical procedures, as well as medication for mental health and neurological conditions. It also includes controlled substances for drug substitution therapy. In addition, we have reminded all member states and governments on the simplified control procedures for the export, transportation, and provision of medicinal products containing controlled substances, specifically in cases of emergencies. An example is, of course, the conflict situations that we're seeing now. Competent national authorities, which are the authorities that assist governments in terms of getting access to this kind of medication, they may permit the export of medicines containing narcotic drugs and or psychotropic substances to the affected areas in the absence of the corresponding import authorizations and or estimates, which are the usual. Urgent deliveries also do not need to be included in the estimates of the receiving countries. The importance of timely supply of controlled substances during emergency situations is highlighted as well as a global issue in our report of 2021. Further actions taken by the board. The board has been working with experts from national authorities, international agencies, and humanitarian organizations to learn from the collective experience. This work has culminated in the publication of lessons from countries and humanitarian aid organizations in facilitating the timely supply of controlled substances during emergency situations. This document that I'm referring to sets out procedures to follow during emergency situations, and the board is encouraging member states to review existing legislation so as to allow for greater flexibility in the international trade of controlled substances, specifically during emergency situations. And now I'm going to step on to the next aspect of the report, which deals with the manufacture and proliferation of fentanyl analogs. Increases in the number of overdoses and deaths in some countries has been driven by this proliferation, and this, of course, really concerns us as a board. Our recommendations as a board are to monitor and test substances as they come on the market, to also refer to the list of fentanyl-related substances with no known legitimate uses that the board has easily available on our site, to prevent exploitation of legitimate industries, and this we do through our work with the grids that I mentioned earlier. And in addition, we also involve private partnerships initiatives to try and address these challenges. We also work with cooperation and sharing of information between the different organizations that I mentioned, including organizations of intelligence, focal points, along with the INCB sections, which are the grids and ionics that I mentioned. The board also has international special surveillance lists, which are also in partnership with PICS, which all assist in making sure that we are very much aware of what is happening when it comes to manufacture and proliferation of fentanyl analogs. This is a huge crisis, and we know that it has caused a lot of deaths, especially in America and in Europe, but it remains a big challenge even across the rest of the world. So if we then look at global issues, specifically focusing on Africa, if population growth trends continue, a higher number of drug users is expected in the next decade in Africa, especially if one looks at the different trends and developments. Cocaine trafficking continues to pose a major challenge to North and West Africa. North Africa and West Africa are used as part of the drug trafficking route into Europe. A growing number of states are permitting illicit cannabis cultivation for medical purposes. So these are the highlights of the areas that have been highlighted to us as members of the board. And we would like to indicate that as a result, we're also going to focus on the same highlights in the work that we do. Coming to Central America and the Caribbean, low availability of narcotics drugs for medical purposes is of concern. Lack of data on the prevalence of drug use. The COVID-19 pandemic, which has caused disruptions to drug treatment services in some countries. Regional issues which relate to being exploited as a transit route for drugs trafficked to North America and Europe. And we see that all of these challenges pose a huge obstacle to achieving what we would prefer, which is, a significant downturn in drug trafficking. In North America, drug overdose deaths, as I mentioned, continue to rise in Canada and the United States. Increased contamination of drugs with fentanyl and other synthetic opioids since the onset of the COVID-19 pandemic is a growing problem. COVID-19 pandemic has also led to decreased access to treatment and prevention services, and there have been changes to regulations regarding non-medical consumption of cannabis, which continue to be adopted throughout North America. In South America, there are larger quantities of cocaine and chemical precursors which have been seized. Traffickers expand networks and routes despite COVID-19 restrictions, and the area under cocoa bush cultivation continued to decrease in Colombia, but it increased in Bolivia and Peru. Increase in ecstasy-like drugs and new psychoactive substances is of concern, and governments in the region prepare to establish cannabis industries, which again touches on the conventions as mentioned earlier. In East and Southeast Asia, there's illicit manufacture, trafficking, and use of synthetic drugs, which is persistent, and as a result, new drugs are emerging. China uses generic definitions to control synthetic cannabinoids. The countries in this region rank low in availability of the most common opioid analgesics, but there's lack of data on drug use and treatment demand, which is persistent. In South Asia, pharmaceutical opioids continue to be seized in large quantities. There's a trend of purchasing drugs on the internet, which appears to have spread. Criminals have adapted to COVID-19 restrictions by also using new trafficking methods and the dark net for transferring earnings through cryptocurrency, which again highlights why our chapter 1 is focusing on illicit financial flows. The region continues to have one of the highest rates of opioid use. COVID-19 restrictions were a barrier to accessing drug treatment in some countries, but technological advances have helped to provide treatment services. There's also been lower levels of availability of narcotics drugs and psychotropic substances for medical and scientific purposes, which of course is of concern to the board. If we look at West Asia, Afghanistan is still the leader in the illicit production of opium. Balkan route is still the main trafficking route for opiates from Afghanistan, and there's continued growth in illicit manufacture and trafficking of methamphetamine in Afghanistan. Central Asian states continue to face trafficking in and use of synthetic drugs, which include amphetamines, synthetic cannabinoids, and other new precursor substances. Countries in the Middle East face continued challenges of tramadol trafficking and misuse, and there's limited capacity to collect and monitor relevant data. We look at Europe. Law enforcement agencies have gained access to encrypted communication devices revealing activities of criminal groups. Legislative developments expand use of cannabis for medical and scientific purposes. COVID-19 restrictions have had limited impact on the illicit supply of and demand of drugs, meaning it continued as usual despite these challenges. Patterns of drug use became more complex due to increase in availability and variety of drugs. Oceania, transnational crime, including drug trafficking, continues to increase in the Pacific Islands, and we are seeing them emerging as transit points for trafficking in synthetic opioids to Australia, to the United States, and to Europe. Most non-parties to the conventions are actually in this region, which is of concern. The board's GRIDS program, training for Oceania customs organizations, also took place in 2021, which we hope will make a difference to how the board is able to partner with member states in this region. The low availability of internationally controlled drugs for medical use in Pacific Island states is of concern, and 4 countries have registered for INCB learning e-modules, which are modules that we deliver to support countries so that they have the know-how to address these challenges. Australia and New Zealand account for most drug seizures in this region. So if we then look at all the information that I've shared, we have come up with a list of recommendations which we are hoping will assist member states. So the first recommendation focuses on illicit financial flows relating to drug trafficking and their impact on development and security. It is important for member states to be aware of the recommendations that were listed earlier, and we will have this information easily available on our website as well. We also encourage universal adherence to the International Drug Control Conventions. Use of cannabis for non-medical purposes requires more focus from member states to make sure that it is not in contravention of the conventions. International drug control conventions and human rights need to be something that member states always respect. Availability of controlled substances for medical and scientific purposes and accurate reporting of data is something that we all need to focus on to make sure that those in need get access to the medications they require. We also are recommending ensuring access to and availability of controlled substances for international humanitarian emergencies, and in this instance we took Ukraine as an example. Other recommendations include strengthening prevention and treatment strategies through information gathering and other means. Narcotic drugs, psychotropic substances, precursor chemicals are some of the different substances that require monitoring. Manufacture and proliferation of fentanyl analogs is a challenge that requires focus, and materials and equipment used in illicit drug manufacture is also another focus area that can help us combat the drug problem. Social media in the promotion and prevention of the use of drugs for non-medical purposes could be one way to go, because we already know that social media is being used to promote drug use. So we should also be using the same platforms to make sure that the general public is informed about the dangers and how to avoid falling into such traps. And then the last slide has to do with precursors, which are very important because, as I mentioned before, there are new precursor substances which are feeding into the illegal drug market. So we need to enhance national precursor chemicals control and regulatory frameworks. And we also need to be aware of the use of internet platforms for procuring these substances and chemicals. It is important to engage the industry so that we are able to have control over the substances that are used for illicit drugs without affecting the normal markets which use the substances for licit purposes. COVID-19 as a pandemic had a minimal impact on supply of precursors for illicit drug manufacture. However, comprehensive and timely sharing of information is essential, and that includes sharing information with the board. If we then look at the non-scheduled chemicals and designer precursors, we are, first of all, very aware of the fact that there are a number of designer precursors out there. And when we talk about designer precursors, we're referring to chemicals which are close chemical relatives, sometimes referred to as belonging to the same family, or chemicals which are intermediate in the pathway to producing specific drugs. These designer precursors are purpose-made, and they do not have any recognized legitimate use and are not featured in the regular trade. So we have an INCB guidance document which looks at options and concrete actions that member states can take, and that includes the international legal framework, international scheduling, national legislation measures and approaches, technical assistance, capacity building, and awareness raising. So international cooperation becomes crucial, and exchange of information and intelligence is also crucial to making sure that everybody within the industry cooperates to once and for all make sure that we win in terms of fighting the really huge scourge of drugs on our communities. And with that, I will end here. Thank you so much.
Thank you so much, Zuki, for that really interesting delivery. I'm sure just the highlights of a report, which I see is almost 150 pages long. So thanks so much for that. I've certainly learnt a lot. I kind of treat myself as a member of public here today, not having a lot of background in this area. So thank you for that. And I also then just need to make a few closing remarks and thanks. So I want to thank everybody who's attended this launch today, whether you've done so in a mask setting or whether you've done so virtually. In particular, I would like to thank a couple of people. Firstly, our UN partners in South Africa, namely UNSA and UNODC, the South African Health Products Regulation Authority, led by Dr. Semete, local, provincial, and national representatives of the Department of Health, the Office of the Mayor of the Nelson Mandela Metro, the senior management of Nelson Mandela University, and all the internal partners of the university, both from the Faculty of Health Sciences as well as across the different departments of the university, including our communications and marketing team sitting way up there. Also, thanks to the members of the media. And then also our administrative support team that has supported Zuki to put this event together. Thank you very much, particularly to the three ladies that have been very involved in this. You've done a really fantastic job. And then last of all, just to our International Narcotics Control Board, thanks for the opportunity to host this launch and for the wonderful work and extremely important work that you are doing. And this report, I think, goes a long way to sensitizing those who don't know about this work, about the fantastic job that you're doing. Thank you very much to everybody, and this now brings this launch to a close. Thank you.